All right, welcome back to All Day Live. We're so glad that you're here with us on a Friday. Hope you're getting ready for a really beautiful weekend. Can spend some time outside maybe and enjoy beautiful sunshine, get that vitamin D. Hospital-based labor and delivery care, if you've followed the headlines at all in the last couple of years, is becoming more and more scarce in greater Minnesota and other states and more rural areas as well. Minnesota Public Radio analyzed the data, and I was reading an article where they found about 12% of the state's population here in Minnesota lives in a county with no hospital-based obstetric services. We've seen recent cuts to labor and delivery in places like Owatonna, Fairmount, New Prague, just to name a few. Well, joining me now is Rick Ash. He's the CEO of United Hospital District. That's a nonprofit critical access hospital in Blue Earth, the only hospital in Faribault County. Thanks for being with us.
Thank you for having me.
You bet. Well, can we start by, I guess, laying out the problem for folks? Why has labor and delivery been this go-to for cuts?
I'm not sure why it's been for cuts. I think it's probably more, in my vision or understanding, it's the reimbursement system in total. And the population, I think that that is of the childbearing years and the health coverage that they have. What we find is about a little over 50% of families that are having children are on some form of government assistance. And unfortunately, the government doesn't pay costs. They're less than costs. So there's just no way to break even on that. And so I think that's part of the problem, is that those services, it's much more costly to lose the money on that. And so that's why some of the systems are closing their services.
Yeah, and does it also, I mean, you think about labor and delivery, and having had two children myself, I know it's unpredictable. It's a 24/7, 365. I mean, infrastructurally, how hard is it to support that?
Well, it's always been a challenge. I've been doing this for 35 some years in rural Minnesota, from the north to the west and now to the south. And it's a challenge because we haven't been able to figure out how to get babies to plan their birth between 9 a.m. and 5 p.m. And so that means that hospitals, rural hospitals especially, have to be available 24/7, 365. And that means we've got folks on standby, ready to respond at the drop of a hat. Anesthesiologist, OBGYN, the C-section surgeons, OR staff, all those folks that have to be ready and available at any given moment.
Yeah.
And so it's very hard.
So tell me what you folks are doing, because again, kind of going back to, keep harkening back to the NPR articles, they've been doing a good job of covering this sort of this issue over the years. The article I was reading said that you're actually swimming upstream on this. Your hospital is, that you've not only kept labor and delivery doors open, you're on track to more than double the number of births this year compared to 5 years ago. So how are you doing that?
Well, the doubling isn't so much of what we've done. I think it's the result of what's happening around us when other systems have to make the decisions that they do, and they close OB services. The families are still in those communities and they have to go somewhere. So in many cases, we're the next closest hospital, so they're coming to us. So part of that growth is the fact that we're still here and the others haven't been. And that's part of, I think, the challenge with it is we want to be here. We're dedicated to our community and to our people to provide not only OB services, but keep as many services available close to home as possible. That being said, we get back to over half of the births have a payer source of government assistance, and they don't cover costs. So as we see more and more folks coming this way, it becomes more and more of a challenge. So the growth is there, but the reimbursement isn't. And some of the things we've done about that, of course, is we don't have we expand into many different areas. So we're like a mini rural health system between inpatient and outpatient and clinic services and ambulance and home health and hospice and therapy services and ancillary. So we try to spread those costs and those services over a much larger base, and that's been helpful. But it the trend is not looking good, I'm afraid.
Mm. We noticed that you had some testimony. I think it was just written testimony this past week in front of the legislature. And you correct me if I'm wrong, because I didn't get to listen to the entire hearing. But it sounded to me like there was possibly some grant money or something. There was an ask there for some funding to do some training to also help. Tell me a little bit about that avenue and what that might do for hospitals like yours and others.
Well, it most definitely is needed because workforce is a challenge. Not only to have those people available and ready at the drop of a hat, but have them trained and qualified to do so, especially when the numbers we see per day are probably much smaller than you see in a metro or an urban hospital. So, how do we train them? How do we keep them proficient, competent, have them feel comfortable and competent in what they're doing, and make sure mom and baby and family are safe as well? And so this money, Senator Draheim is advancing it to provide grants to help cross-train and support training for rural healthcare professionals. There are no specific numbers yet that I've seen, but I think it's an important step in many steps that need to be taken to help keep rural healthcare viable. And I hope that the legislature looks at that and gives it a very serious effort to try and get that moving forward.
It sounds like maybe that training piece, well, is one piece of the puzzle. I mean, there must be obstacles to that. I mean, is it a long, intensive? Do you have to travel for that kind of training, or is that why?
Well, there's lots of different reasons. You mentioned several of them. I mean, if we can bring the training here, that's even better because then we can have more available if the trainer can come here. And so there are opportunities for simulation training, things of that nature. We've been working with Children's Minnesota to do some of that training to make it available. But there's much more that needs to be done. But yeah, travel, access, and folks don't always have the ability to take a day off to go travel to the cities for training, as well as if it's overnight. And now you've got lodging and other costs as well. So, and also to be able to have some of that hands-on experience, which is also very important as well.
Would any part of so if you were able to expand, maybe not expand, maybe that's not the right word, but if you were able to have some money or a hospital had some money to do what you needed to do for the training piece of it, would that include maybe expanding who could help, who could be part of the labor and delivery service? Maybe somebody that normally wouldn't be?
My first response to that would be yes. I think we need to look at those types of things. Not being a clinician, I want to be a little reserved and careful on who or what that could be, or how that could work. But I think as we do in rural healthcare, we have to open our eyes and look at all the options. Obviously, always with the focus on keeping family or people safe and not doing any harm. But sometimes we have to wear multiple hats, and there are opportunities to do that. And so, yes, that is one of the ways.
What's been the reaction in the community where you are in Blue Earth? There's about 3,000 people or so, but Faribault County, you're the only hospital there. What have people told you about the way things are right now and what they want to see?
Well, the comments vary and all over the board. I think those that are paying attention and hearing and seeing what's going on or experiencing it, I think there's concerns about keeping healthcare locally. I know to our community to our west, Fairmont, with some of the changes that were made there with OB services and surgery services ceased last year. Folks have choices to make now. It's not a matter of 5 or 10 miles to get to their local hospital to deliver their baby. It's potentially 20, 30, 40, 50, or 60 miles, and potentially more depending on where you're starting from in the county. So people are concerned about those kinds of things. It isn't just OB, but OB is very top of mind simply because of the impact that 15, 20 minutes on the road can make.
Yeah, absolutely. I mean, yeah, we've heard it from, EMTs. We've heard it from a lot of different areas as well. In the same sort of issues where the reimbursements for things like Medicaid just aren't cutting it, and the services suffer. The patients unfortunately suffer in those cases. So, thanks for joining us. I really appreciate it. Is there anything else that you wanted to share with us that I didn't get a chance to ask you about?
Well, I think from the big picture, keeping services close to home are extremely important. And keeping healthcare local is always important. But the other part that people don't always think about is what are the impacts or effects that happen to a rural community or a region when they lose a hospital or they lose services. Um, we're not in it for the economy as far as building jobs, but we do by having doctors and nurses and uh, uh, 300 plus people in an organization that impacts the community from housing to taxes to other businesses coming in because there are more employees and more workforce. It's an impact to the community economically as well. So if you lose a hospital, if you lose services, you're losing part of your community. If you take a look at some of the places where hospitals have closed, you'll take a look at what's happened to that community. So it's important. I think we all need to kind of put our shoulder to the uh, problem and keep pushing forward.
Yeah. Rick Ash, the CEO of United Hospital District, nonprofit critical access hospital in Blue Earth in Faribault County. Thanks for spending some time with us today. We'll be watching that bill through the session.
Thanks for having me.
You bet. All right, take care. All right.